So, as the winter COVID surge is starting to really run out of control, now's a good time to reevaluate masks. So, at the beginning of the pandemic, there was a severe shortage of proper masks. As a result, people were encouraged to wear homemade cloth masks. This wasn't a bad idea at the time when little else was available. These masks are reasonably effective at trapping the virus laden droplets exhaled by someone infected. It helps protect others, but offers much less protection for the wearer. But it was much better than nothing at the time. But at this point, there's really little reason to still be wearing homemade cloth masks. Commercial medical grade masks are really readily available and they're far more effective. Given the alternatives available, it seems foolish and dangerous to still be wearing just cloth masks. And, the other thing is that masks absolutely work. There's now a large body of evidence from field studies to show that areas with increased mask usage have reduced rates of community spread. So don't let the grifters and the deniers convince you of the lie that masks don't work. So let's talk about the major categories of masks. So it's important to understand the distinction between protecting others if you're the one infected versus protecting yourself from others. We've seen the virus progress in the US at about the rate of 1% of the population per month. That means that on any given day, 99 out of 100 people wearing a mask should be worried about how to best protect themselves from infection, especially those who refuse to wear a mask or refuse to wear one properly. So let's talk about how the different types of masks work for protecting the wearer. The absolutely worst are the gaiters, and they essentially offer no protection whatsoever. They neither protect the wearer nor they protect others. Next up are the single layer cotton cloth mask, and they're probably only about 20% effective at protecting the wearer. Multi-layer cloth masks are much better, especially ones made from polymer fibers, not from natural fibers. You should avoid cotton masks. So a 2 to 3 layer polyester mask will likely be about 40% effective. The next step up are the paper surgical masks. These come in a variety of categories and are generally rated as level 1, level 2, level 3, or unrated. The higher the level numbers are, the better the mask. The lower rated paper mask will generally be about 50% effective or less, and typically not better than wearing a multi-layer cloth mask. So always try to find a level 3 surgical mask. They're readily available. These are generally going to be 3 or 4 layers and will be about 70% effective at protecting the wearer. Now the best, if you can get them, are the N95 masks. And specifically the medical grade N95 masks that do not have a valve. The valve makes the mask completely ineffective at protecting others. You essentially have a hole in the middle of your mask, which doesn't help. So yeah, you're just breathing all your germs directly onto whoever's in front of you, and if that's all you can find, then tape over the valve from the inside. The mask will work fine with the valve taped over, and you're now protecting others as well as protecting yourself. So N95 is actually a government standard enforced through the National Institute for Occupational Safety and Health, or NIOSH. It defines both how the mask has to be constructed and what testing standards it needs to meet. There's also a KN95. These are nominally the Chinese equivalent of the US N95 standard. But you should absolutely avoid any mask designated as KN95. These are Chinese made and are 100% guaranteed to be fraudulent and worthless. There are excellent N95 and KN95 masks being made in China, but currently they're all barred from export and are being diverted to domestic use within China. However, the Chinese government is more than happy to have counterfeit masks exported abroad and are making no efforts to block these worthless KN95 counterfeit masks. So now for the really bad news. At the current time, almost the entire production of authentic N95 masks being manufactured in the US are being diverted into either US government purchases or into the medical supply chain. None of these masks ever reach the US consumer market. So almost all of the N95 masks currently available on the US consumer market are counterfeit Chinese manufactured masks, including all the brand name masks like 3M. The masks are largely worthless. The branding, packaging, and certification documents are all forged. Unfortunately, the US government has chosen to turn a blind eye and are freely allowing counterfeit and even branded masks to be imported into the US consumer market. So I know a guy in California who has a nonprofit trying to source N95s for nursing homes and hospices who don't have access to the medical supply chain. His group has tested almost 8,000 domestically sourced lots of N95 masks, including brand name 3M masks. 100% of these are either completely counterfeit or fail validation testing. So I want to talk about a new type of mask, KF94 mask. I've spent months trying to source N95 mask and have seen the same issues. However, I've recently discovered a solution to the problem. The South Korean government has their own version of the US N95 standard called KF94. These masks are manufactured in South Korea and are required to undergo validation and oversight by the regulatory bodies in South Korea, and they're readily available in the US consumer market. So Amazon carries several brands, but you have to search specifically for KF94. They won't show up if you search for N95. They're typically about $2.50 to $3 a piece, so actually cheaper than the counterfeit N95 mask. The deal is almost no one in the US knows they even exist. I didn't until a month ago. Just make certain that you buy only ones actually manufactured inside South Korea. There's also an EU standard from Europe called FFP2. That's their equivalent of the US N95 standard. Unfortunately, 100% of the FFP2 masks that I've been able to find in the US market are Chinese imported counterfeits. So if you're in the EU, it's a good option, but if you're in the US, I would absolutely avoid the FFP2 mask. So let's talk about face shields. Basically, they're completely worthless. Unless you're intubating the patient in ICU and they're spraying droplets directly in your face. Face shields are not a replacement for wearing a mask. They only help to keep direct droplet spray out of your eyes. They don't even help to keep virus-laden aerosols out of your eyes. The aerosols just pass around the edge of the mask or the face shield and directly into your eyes. So unless you have an issue with people coughing directly into your face from less than 3 feet away, don't waste your time or money on face shields. But that's not to say the concept is useless. You're just as likely to get infected through your eyes as through your nose or mouth. If you have to be in a crowded area with people not wearing masks, then protecting your eyes is critical. But an alternative are sports goggles. They can be very effective. And I'm not talking about the bulky ski goggles. There are a couple of manufacturers of prescription sports goggles that look like ordinary glasses. They just have gaskets behind the frames that fit up against your face. You don't need an airtight seal, just the ability to block normal airflow around the eyes. So a company called Zenni, another one called Wiley X, are great manufacturers. I prefer the Wiley X goggles designed for skydiving. They look like normal glasses and they're quite effective. So closing thoughts: quit wearing cloth masks, order some KF94 masks from Amazon, at least get some level 2 or level 3 medical mask. Forget about the face shields. Get some sports goggles to protect your eyes. You can get them as prescription goggles. They're typically only about $100 a piece. But also learn how to properly fit and wear a mask. It needs to be tight against the face as possible. Good N95 masks are designed to seal against your face, but even the surgical mask can be a close fit to your face. A poorly fitting mask is really quite worthless. You just breathe around them. Also, if you have to go into crowded areas where distancing just isn't possible, people are refusing to wear masks, then I recommend double masking. So you put an N95 mask on first, and then put a level 3 surgical mask on over the top of the N95 mask. This will offer the best protection. But also wear goggles to protect your eyes. They're just as vulnerable as your nose or mouth. So that's it for this video. Hope this was useful information. Thank you.